Hello and welcome to JOLYN Q&A. I'm Harriet Brown, a surf Ironwoman and JOLYN athlete, and we are so lucky to be joined today with Gold Coast-based obstetrician and gynaecologist Dr. Drew Moffrey.
How you going?
Dr. Drew works in Bladder Private Hospital. Drew has been a member of Northcliffe Surf Club for over 15 years and has won numerous Australian titles, is a member of the Australian Lifesaving Hall of Fame, and in recent years has developed a passion for triathlons and is regularly competing in them. So he knows all about water sports, which is awesome. Drew is an expert in his field and has kindly donated his time to us today to help answer some of your questions. After my JOLYN vlog and the live Q&A about menstrual cycles and the female athlete, we were inundated with so many questions coming in that I simply couldn't have answered. So many of these were medical related, and there's no better person to help us answer all your questions than obstetrician and gynaecologist Drew. Drew has worked with many athletes over the years and has 2 daughters himself. Drew, thank you for coming in and joining us here at JOLYN. The questions I'll be asking you are from the JOLYN girls, from JOLYN Instagram.
Great.
JOLYN is a community of like-minded women who love being active, healthy, and JOLYN's mission is to inspire women to be confident in themselves and to create a platform where we can have open and honest conversations about what matters to us. The questions today will cover a range of topics from irregular periods, issues with periods, the practicality of managing your period, pap smears, thrush, and training with your period. So a whole range of questions that we had coming through, which is really cool. But firstly, tell us a little bit about yourself and what you do for work.
Well, I'm an obstetrician gynaecologist, so basically all women's health is my forte. So I look after women from right when they first get their period all the way through to fertility workup, the whole way through their pregnancies, and I deliver their babies, and then all the way through to menopause and beyond as well. So essentially any women's health problem their whole life is my domain, so it's going well.
Awesome, so we've definitely got the right person to answer all of your questions.
Absolutely.
So firstly, a lot of you all wrote in about having an irregular menstrual cycle, irregular period, or not getting your period at all. So firstly, what is a healthy regular period?
So a healthy regular period should be coming around every 28 days and a bleeding from anywhere from 3 through to 7 days. Now, this can give and take a few days here and there, but generally you should be around that regular cycle of about 28 days. It does vary a little bit when you first start getting your period. When you very first get your period, it might be a little bit irregular for the first 6 months or so, but then from then on you should quite regularly get it every month.
Okay, so there's quite a few girls that are saying when they're training really hard, they're not getting their period for quite a long time. And in the past, this has kind of been seen as, oh, this is great, we don't have to get our period while we're swimming. But is there a problem with this?
It is. Essentially what that's called is functional amenorrhea, and it happens a lot. There's a lot of elite athletes that won't get their period, and there is a problem. Essentially what's happening is your body's telling you that it's not ready to get pregnant, because obviously that's what the ultimate aim of people having their periods is pregnancy. So your body's under such stress that it actually can't cycle properly because it can't carry a pregnancy. Functional amenorrhea, whilst like you said, a lot of women think it's great because they don't have to have their worry with their periods, it does cause issues with down the track because things like low bone density and a few other issues can cause problems if you leave it long term. So it is something that you need to talk to your doctor about. Okay,
so if you are listening and you're a girl who's not getting your period, is it best to just go and see your doctor and talk to her about this?
Definitely. Go see your GP first.
Mm-hmm.
Unfortunately, we can't do a test that says, yes, this is the reason why, because of your training, you're not getting your periods. So what they do need to do is they need to rule out other causes of why you're not getting your period. So it's something that in the medical field we could call an diagnosis by exclusion, which means we just double check to make sure that there's nothing else wrong, and if everything else looks okay, then we call it functional amenorrhea. And so you do need to see a GP just for them to check a few other little things like your thyroid and a few other checks, just to make sure that the reason you're not getting your period is because of the training. And then from then, your GP will help you. And the biggest reason whilst women get the functional amenorrhea is their caloric deficit. So basically, you're not fueling your body well enough to train that hard, and your body's under such stress, that's why you've lost your period.
Yes, that's super interesting, and I think that's pretty common, especially in sports like swimming, where we train so much and it's hard to eat enough, and sometimes body image is an issue thrown in the mix there. So I guess seeing a doctor and a dietitian might also be pretty helpful.
Yeah, and it's really interesting because if you actually just increase your caloric intake a little bit, you're actually going to perform better. And I know a lot of women think, oh, by eating more, it's like you said, it's going to put weight on, it's not going to function as well, but it's actually just the reverse of that. By increasing your caloric intake, your body's going to function better because your hormone profile is going to be better and your actual body is going to just function at a higher level.
So it's really important that we get that message across then.
100%.
Awesome. All right, we're heading on to talk a little bit about different symptoms related to periods. We had so many questions about this. And firstly, this is something that I know a lot of girls suffer from, but just in general, is it a problem when you have really painful periods, and what should we do about this?
Look, Harriet, one of the big things I stress to everyone is there's no such thing as a normal painful period. So any period that you get that's painful, and it's painful to the level of needing to take days off school, take days off training, that you're sitting in bed taking pain relief more than just a simple Panadol, is not normal. Sometimes, especially young girls who, when they first get their period, might get some cramps, they might just take Panadol, but they're still able to go to school. That's okay. But if you're missing things, missing training, that's not normal, and you definitely should see your GP. There is no such thing as a normal painful period. So if your GP dismisses it and just says, oh, look, it's fine, don't worry about it, that's not okay. You should go and get a second opinion. You definitely need to see someone.
That's really good to know, because when we did a poll in the JOLYN Instagram, 77% of you experienced painful period cramps.
Yep.
And 66% said that having your period has stopped you from training in some way. So definitely something to look into.
Definitely
right?
something to look into. Unfortunately, in Australia, the average time from women with endometriosis from first symptoms to diagnosis is 7 years. So that means these poor women are having painful periods for 7 years until they finally get listened to by their GP and get referred and get investigated. That's just far too long.
Yeah.
So a period, like I said, simple analgesia might be okay, but if you're actually missing stuff, you definitely need to get that checked out.
So you mentioned something like endometriosis. So a lot of the girls listening may not know what that is. So there could be underlying issues going on from your painful period?
Yeah, endometriosis is one of the most common causes for painful periods. And what that is where the lining of the uterus, which builds up every month, and when you don't get pregnant, that's what sheds and that's what your period is, that actually goes to other parts of your body. I know that sounds really weird, but basically it goes to other parts of your body, around your pelvis, around the ovaries, around your bowel, and each month it doesn't realise that it's not in the right place anymore. It doesn't realise it's not inside the uterus. And so it still builds up and sheds when you have your period, and that blood is what causes irritation within your pelvis and causes that pain. And that's definitely not normal.
No, so don't put up with your painful period and go and get it checked out.
100%.
So next one, menorrhagia or heavy periods can be pretty frustrating, especially when you are a water sports athlete. What's your advice for girls with really heavy periods, and is this something to see your doctor about as well?
Look, really heavy periods is something to get investigated because often there is a really simple answer to it. Often there might be something like a small polyp there or hormones just slightly imbalanced, and it can be really easily fixed. Some people, unfortunately, do just have natural heavier periods than others. There is a really big variation of normal, but one of the things is it's really easy to be treated as well. So if you're having heavy periods, there is some simple medication that we can give you. It doesn't even have to necessarily involve hormones, but there's simple medication we can give that does help with those periods. And then obviously there is things like the pill and the birth control that can definitely lighten up your periods and even stop your periods full stop.
Cool. Well, it's great to know that there's things practically that we can do to help that. A little bit about a heavy period. We've had a question come through. Is it normal to have a really heavy period for maybe a couple of days and then really light after that?
Yes. Yeah, so a common period will be a lot heavier in those first 2 days. And once again, it's variable how women describe what their heavy periods are, because one woman's heavy might be another woman's normal, and unfortunately it does, to a certain extent, depend on family situation when they talk to their mum and they talk to their sisters and what they're used to in terms of heavy periods. But in terms of what a period should be, the first 2 days will always be the heaviest, and then it will taper off. And it can often just be light spotting for 2, 3, 4 days after that, after that initial first 2 days of being heavy.
Okay, so everyone's pretty different, right?
Yeah.
So is it normal to have like bits of stringy blood or abnormalities within your period, different colours, things like that?
Yes, and your period colour will change throughout the 5-7 days of bleeding. And those last couple of days, it might just be sort of stringy mucus things, and it might just be a little bit of spotting, and then the next day it might be a bit heavier again, then ease off to spotting. But realistically, that tail shouldn't go more than 7 days in total.
Okay, great to know. So everyone's a little bit different, and it's great that we can actually have a conversation about this.
Exactly.
Yeah. What about breast tenderness? Is there anything that the athletes can do to reduce this, especially if they're, say, board paddling or doing a sport like that?
Look, breast tenderness is often involved with what we call PMT, and often it comes kind of the week before your period. I'm sure a lot of young girls notice they get a little bit their mood changes a little bit and things like that. There is a few little things, and it's just practical things that people can do. I know it sounds funny, but there's been a lot of evidence around cognitive behaviour, so relaxation techniques, meditation and things like that, that will reduce your stress, and it reduces things like breast tenderness. Once again, one of the big things that can reduce breast tenderness is the pill, so we can use the pill to help manage your cycle a bit more, and that will also help manage breast tenderness as well.
Oh, that's really interesting. I didn't know that. One more question about periods. One person has written in saying that their period's getting more painful with age. Is that normal, common, or is things just changed? No,
that's not normal. And once again, a painful period, especially if you've been pain-free and then you start getting painful, that is a warning sign.
Okay.
And I'd be very suspicious of something like endometriosis, because often endometriosis develops with time. Girls' late teens, early 20s is when the peak time of endometriosis is.
All right, so go and get it checked out.
Definitely.
Great, let's move on to talking a little bit more about health. So at what age should a girl get a pap smear, and why?
So the pap smears have changed a lot over the last 5 years because there's been a new screening test that's been introduced. So the short answer is you don't have to worry about a pap smear until 25 now. It used to be 18, but up until the start of 2018, then the age has changed. Some girls will be caught in that little sort of window where they've had a pap smear early because they were 18, but then now they're not before 25. The answer is you don't need one until you start turning 25. What we used to do with pap smears is we used to just look at the cells of the cervix and see if they're changing, but now we've actually developed a test to check for the virus that causes these abnormal cells. So HPV is the virus. Unfortunately, HPV is really common. About 80% of people will have HPV at some stage in their life. There is a vaccine for HPV, but only certain strains, and they're the really nasty strains that cause about 70% of cervical cancer. So it's not all cervical cancer strains, but the majority of them. Thankfully, that's been rolled out in schools throughout Australia, and we're seeing a significant drop in HPV and cervical cancer. But the simple answer is, once you hit 25, you need to get that test. And if you don't have the virus, thankfully it's every 5 years now. So it's stretched out a little bit. It used to be 18 at every 2 years, but now we know that we don't need to worry until 25, and it's every 5 years if it's normal.
That is really good to know. So you said 80%. So if someone has HPV, is that something to stress about, even though it's so common? What's the go there?
Thankfully, if you've had a pap smear and you've got one of the cervical strains of HPV, then yes, you need to get checked every year to make sure that's okay. But HPV is kind of like the common cold. There's hundreds of strains. Some of the strains cause cervical abnormalities. Some of them cause penile cancer. Some of them cause genital warts. Some of them don't do anything at all. So when we say 80% of the people, 80% have had some strain of HPV. So it is really common, and unfortunately there's nothing you can really do about it. So it's no need to stress, it's no need to worry, but it is super important just to keep getting your pap smears.
Great, so monitor it but not worry and stress.
Exactly.
Awesome. So here's a bit of an interesting one. Some athletes get pretty nervous before they race and always want to have a bit of a nervous pee.
Yep.
I know I've definitely done that in the past, but sometimes it's hard if you're doing sports that, the toilet's a long way away, a fun run, something like that. Have you got any tips for this?
The tips that I sort of say is definitely work on your pelvic floor. There is a thing called bladder training, and if you find that you're going to the toilet a lot and you just sort of get an urge and think, I need to rush to the toilet within the next minute or two, otherwise I might have a little bit of leakage, there is a thing called bladder training. But so what happens is essentially when you first get that urge, You hold on, and what you want to do for the first week, when you get that urge, you want to hold on for 30 seconds. After a week, when you get that urge, you want to hold on for a minute. And literally write down the weeks and the days and how you're doing. And so you've got this sort of little, almost a reward chart. And that bladder training is going to help with that pelvic floor, but also help with your urge to go to the toilet frequently. Because most women will have a really good bladder capacity, but it's actually just the bladder training, and it's almost like a habit of needing to empty it really frequently. So if you can do that bladder training, you're going to be okay.
That is really interesting. So I guess like when you're training in the pool for racing, you can train your bladder to be stronger and not
100%.
have to give way so easily.
Exactly, 100%. Obviously, the other thing as well is pelvic floor is really important with your bladder. So lots and lots of pelvic floor exercises, and you can see a physiotherapist or exercise physiologist for that, and they'll be able to help you with that as well.
Cool, because that'll help when people, cough and sneeze and might get a little bit of leakage with that as well.
Exactly. Yeah.
Awesome. All right. What should we do if we see swelling, bumps, growth, or anything else going down in our pubic region?
Look, this answer was sort of a little worrying to me. If you ever see any changes like that, you definitely need to go see a GP straight away. So any sort of abnormalities in your pelvic region and around the vagina, you definitely need to go and see a GP. I can't stress that enough. These sorts of things aren't something that you should just sit on, because they're probably easily treatable is the first thing. But secondly, a lot of those conditions, if you leave them long term, they can cause long-term issues, such as issues with fertility 5-10 years down the track and things like that.
Okay, so don't just put up with it, go and see someone.
Definitely go and see a GP for those sorts of things.
Awesome. Another question, girls sit around in wet swimwear often. At a carnival, they could be sitting in it all day and sometimes leads to developing thrush. What is thrush? What's the common symptoms, and is there anything that we can do to kind of avoid that?
So thrush is just I know it sounds a bit horrible, sorry ladies, but thrush is a fungus. So and thrush it's not a sign of anything nasty, but basically what it is when the fungus takes over the vagina because it imbalances the natural bacteria in the vagina. The symptoms you'll get is you'll get a white discharge. Often that discharge can turn to yellow, but generally it will kind of have a consistency of little clots, and almost, once again, sorry if anyone's eating, but cottage cheese is often the classical description of thrush. There is often a smell with it as well, but the itch is the big one. And you'll notice an increase in discharge and an increase in itch. You definitely should treat thrush. It's something that should be treated, and thankfully it's very easy over the counter. You can go and just to the pharmacy and get Canesten is the easiest one, and you can just get a little tablet that you put inside the vagina before you go to bed, and the next morning you wake up and your thrush is pre-treated. In terms of avoiding thrush, one of the really good things is probiotics. I'm a really big believer in probiotics, and I think all athletes should be on probiotics because you do have a weakened immune system because your body's under stress so much. But probiotics would definitely help with thrush. The other thing, I know it sounds funny, is actually sleeping without underwear on. So if you have pajamas or you have a nightie, that's fine, but just not tight underwear, because airing out the vagina at night actually really helps decrease the risk of thrush.
All right, good to know. We've got a few more questions, just stepping back a little bit to the basics.
Yep.
If a girl's getting their period for the first time, do you have to stop swimming
Definitely.
when you get your period?
Definitely not. It depends on how the woman or how the young girl's going in terms of whether she feels comfortable or not using tampons. You shouldn't really swim with a pad on. You should use a tampon. Now, some young girls will still have what we call a hymen, which is a very thin piece of skin right at the opening of the vagina, and they might feel a little bit uncomfortable putting a tampon in for that. But once again, they will, if they use a very, very small tampon, they will be able to go, and over time that will become more comfortable. But you should use a tampon when you're swimming, not necessarily a pad at all.
All right.
It's just up to that girl how comfortable she feels with it.
Yeah, so just starting to figure that out and being able to keep swimming training so that you're not stopping when you get your period.
Exactly.
Awesome. Well, thank you so much for joining us today. You've given us some really valuable information that is often hard to Google, and it's really hard to get this information that is specific to us girls and especially athletes. So many girls are craving this information, and we saw that by getting so many questions through on the Instagram. But sometimes it's hard to talk about this stuff, and it's hard to know where to get that information from. So it's been really valuable to have you here. But my final question is, some girls are a little bit concerned about not feeling comfortable talking to their male coach about issues to do with their period, to do with their menstrual cycle. You're male, you have these conversations every day.
Yep.
Do you have any advice on how these girls can kind of combat that or bring it up? Or
Look, it's really hard, and I understand where they're coming from, because often if their coach isn't open to these conversations, one of the things I'd suggest is maybe go with other girls your same age, and so that way it's not as intimidating just being a one-on-one conversation. Maybe have a chat with some of your friends, and then 2 or 3 of you can go and have a chat to your coach. That's one thing that I'd really strongly recommend. The other thing as well is, if you are really feeling embarrassed about talking to your coach, maybe have a chat to your mum first and get your mum to bring it up with your coach as well. I would say the other thing though is a lot of men need to be able to be more open to this, and that would be my biggest thing. Is first, it's been team sort of secret women's business. It definitely shouldn't be. And if you're a male coach, you should be actually open to talking to this with your female athletes. And look, they may need to go and speak to someone like me, or they might need to go and speak to their GP so that they can actually learn more about it. And them educating themselves is going to be better for their athletes.
Awesome. So any male coaches out there,
give me a call.
Give Drew a call and educate yourself so that you can best care for all your swimmers, especially your female athletes that you've got there. So thank you so much again, Dr. Drew. For any women or men interested in hearing more from you or seeing you, where can they find you?
Look, all my socials is around. It's Dr. Drew Moffrey, both at Facebook and Instagram, or just drdrew.com.au.
Great, and we will put a link to those in the caption, I guess. Do you have any last pieces of advice that you would like to share?
My biggest probably thing, and I know we've said it and I probably sound like a broken record, but the biggest thing I say to young girls is painful periods aren't normal, so go and get them checked out. That's probably the biggest piece of advice I want to get through to young girls. And the other thing would be if you're worried about anything, see a GP sooner rather than later, because there's no point in worrying for years, because most of the time it's actually a really easy fix.
Wonderful. Well, thank you so much. You've been so generous with your time and your advice. And from myself and all the JOLYN girls, we want to say thank you.
No worries, thank you.